Hello everyone and welcome to Action Mesothelioma Day 2020, and what an unusual one it is. First of all, I'd like to say a massive thank you to everyone that's donated so far. Going into the day, we're already at 32,000, which is an amazing amount, and we can't thank you enough. So the theme of Action Mesothelioma Day this year is actually the patient charter. So I'm sure that you're aware that there's been lots of information, 1 to 15 points regarding the charter for mesothelioma patients. So today we're calling on the government to implement all the points that are raised in that charter, and this is to really just raise awareness and to make sure there's a better outcome for mesothelioma patients. So with that in mind, we will now be moving on to release the butterflies. So take care everyone, and hopefully we'll all catch up soon. Bye bye.
Hello everyone, thank you so much for joining us today. As Lisa said, it's a completely different Action Mesothelioma Day to what we're used to, but it's nice to have you here watching us release our butterflies. Before we do, Ali's going to say a few words about what the butterflies mean and the significance to the day.
Thanks, Jo. Butterflies are a powerful representation of life and often associated with the soul. So around the world, people view the butterflies as representing endurance, change, hope and life. So what better symbolism to represent our Action Mesothelioma Day. As we release the butterflies, we'll be thinking of you all at home and hope you're watching, and hopefully it brightens your day a bit. We hope to see you soon.
that was beautiful. I hope you all enjoyed that. Now we've got the lovely Anne Moylan, who's the lead Mesothelioma UK nurse specialist from the south of England, and she's going to do a talk.
My name's Anne Moylan. I'm a mesothelioma nurse specialist based at Queen Alexandra Hospital in Portsmouth. I've been asked today to say a few words about what a mesothelioma nurse does, what a nurse specialist does really. Nurse specialists really came into the fore in about 1995, when it was recognised that they could be pivotal in smoothing the pathway for people who were being investigated and diagnosed with a cancer. So they're not only for mesothelioma or lung cancer, they are available or should be available for people with any type of cancer. And this slide really shows that they are seen to sit in the middle of a lot of things that are going on for patients when they're under investigation and when they're diagnosed with cancer. And I think within the health field, they are recognised as a vital component to the patient pathway in this scenario. Many of the documents that are produced by the government and other organisations highlight the role of the nurse specialist. And actually, in the latest COVID crisis that we've just had, it was recognised that they should not really be redeployed onto the wards because they played such an important part of maintaining the well-being of patients with cancer. So what do we actually do? Well, we're really seen as what we call the key worker, and that just means that we're a point of contact. We're your liaison between departments. We help with symptoms, with advice and support. We're there to give disease-specific information. We have expertise in our field, and especially in the world of mesothelioma, which is so small because it is so rare, we have some really good contacts that we can use, not only locally to wherever we're working, but nationally. We are also your advocate, we're your voice. And I think often people will come to us and tell us things that they're worried about or they're unsure about, things that they maybe want to get over to a doctor but don't feel that they can. And that certainly for me is a really important part of my job. When it comes to treatment, again, it's about having the expertise to help to guide people, to make the right decisions for them. Clinical trials are so important, but they're not for everyone. And I think it's important for people to know the details of the trial. Where does it sit within how the trial runs? Is it something that's been around for a long time? Is it very new? How far do they have to travel if it's not available locally? And all of these things need to be taken into account when you're thinking about what treatment and trials would be right for you. Once that's decided, then we can help to liaise with the teams elsewhere, get your information to them to see if you're eligible for the treatment that's being offered, and to maintain the communication between you and that other team so that you're kept informed at all times in a timely manner as to what's happening with you. Mesothelioma UK recognise the importance of having nurse specialists based locally in NHS hospitals. When I started in 2014, I was only the 4th nurse in the country. We now have 28 nurses in 23 trusts up and down the UK. We're all very patient-focused and hope to offer expert care and advice to you and your family. This is where the nurses are based at the moment. We have some new posts coming in the next few months. Unfortunately, they've been paused at the moment due to the COVID crisis, but we have got plans to move those forward. As you can see, the support of groups like Hasag are vital to us and our work. My post is part funded by Hasag, as is Helen Wilkes' post in Southampton, and they are just about to help to fund a 2-day-a-week nurse post in Essex. So there will be more stars on this map in the next couple of months. Here in Portsmouth, we're lucky enough to have me as a full-time nurse specialist. My funding is 3 days a week from Mesothelioma UK and 2 days from Hasag. To be able to be full-time is a real privilege. It does allow me to focus completely on you and the patients here in Portsmouth, rather than being part of a lung cancer team as I was before. I'm also the team leader for the South, covering 12 Mesothelioma UK nurses, and project lead nurse for the Armed Forces project that Mesothelioma UK has. I'm very much involved in research and audit, in conferences and meetings, which are taking a very different format, like this one today at the moment, all online rather than in person. I do miss that a lot. I'm so grateful that over the last few weeks, we're seeing more patients coming back into the hospital. It's been so difficult doing the work on the phone these last few months, and it really means so much to be able to see people face to face, not only to me, I think, but to them as well. Mesothelioma UK and Hasag have very many shared goals. We are both incredibly patient focused. We want the best for people when they're diagnosed with mesothelioma, and Hasag's role within all this is absolutely vital. The other things that Mesothelioma UK have that could support you: we have a quarterly magazine that features lots of stories and articles, upcoming treatments and trials. We have an information line that's open every Monday to Friday from 8 to 4:30, and there is a nurse specialist on that information line every day. So if you don't have a mesothelioma nurse locally, you can access some advice and support by speaking to the ladies at the information line, and they will put you in touch with the nurse. The website is always updated with information and events. Our Patient and Carer Day, which was due to be in Southampton this year, unfortunately is now going to be a virtual event, but we'll make the best of that as we can, as we have been the last few months. And it will be back in Southampton next year. So we very much look forward to welcoming you to the South Coast then. Thank you.
That was a great Anne. Thanks so much. And now we've got Jo Hargraves. She's the Thoracic Mesothelioma UK nurse specialist, and she's based at St Bart's in London, and she's going to give us a talk.
Hello, my name is Jo Hargrave. I'm a Mesothelioma UK and Thoracic nurse specialist based at Bart's Hospital. I'd like to say thank you very much to the Hasag team for asking me to do a very quick trials update for you as part of their Action Mesothelioma Day. It is a whistle-stop tour, just to give you a little flavour of what's out there, but I do include in the presentation information about where you can find out more about the studies. So this is the trials update as part of Action Mesothelioma Day 2020. So here we have a summary of the studies that are available in the UK at the present time, divided this into surgical trials, first-line trials, so that which is your first course of chemotherapy treatment for your mesothelioma, maintenance studies, so those that continue after your first-line treatment while the mesothelioma is stable, and then second and plus line, so second-line, third-line treatment studies that are available at the present time. At the bottom, so across all lines, there's two studies that I've included. So there's the Assess Meso study and also Systems 2. And on the slides that follow, we're going to look at each of these studies in a little bit more detail. So Mars 2, this study is about to close at the end of July. The trial will have closed to recruitment. We will have recruited 326 patients. All patients in this study receive standard of care chemotherapy. So that's a combination of a platinum-based drug and pemetrexed. After 2 cycles or 2 doses, patients will be randomised, so there'll be 50% of patients will continue with their chemotherapy up to 6 doses, and the other 50% would have an extended pleurectomy decortication. And as I say, this study will be closing to recruitment at the end of July, so this is something that you would like to discuss, then please do talk to your local team about this quite quickly. Another first-line study currently running is Beat Meso. In this, again, all patients have standard chemotherapy, so a combination of 2 drugs, and also they have a drug called bevacizumab that helps prevent the growth of blood vessels and tumours. 50% of those patients that enter the study will also be given atezolizumab, which is an immunotherapy. So all patients in this study have 3 drugs, so that's 2 chemotherapy and bevacizumab, and 50% of the patients will get the fourth drug as well. ATOMIC is a study for patients whose mesothelioma is not the epithelioid type. So if your mesothelioma, you've been told it's sarcomatoid or biphasic, this may be a study that's for you. So as with all first-line trials, you will receive standard chemotherapy, so the combination of a platinum-based drug and pemetrexed, and then you'll be 50-50 randomized to have a weekly injection either of a placebo injection or something called Adipeg 20 that deprives the mesothelioma of a protein that it needs to grow. So that's ATOMIC, and that's for non-epithelioid mesothelioma. So moving on to maintenance trials. So these are studies that you can ask to be referred to once you've finished your first line of treatment. It may be that at this time your local team will offer you the opportunity to stay under watch and wait or surveillance, where they will plan to see you, say, once every couple of months to ask about your symptoms and possibly to repeat your CT scan. So it's at that point, as you're coming up to finish your first line, that you can ask to be referred for maintenance treatment. It's very important that your mesothelioma is not growing and that it remains stable. If your cancer is growing at first line, you would then need to be referred for second line treatments. So to enter a maintenance study, you must be told that your mesothelioma is stable. So there's two options. So we have the NEMO study. This is a trial where you are given either oral nintedanib, so you can take this as a tablet, or a placebo medication. You do need to be referred for NEMO. I believe it's around the 4th cycle of your first course of treatment. So at that point, do speak to your clinical team and ask for referral to NEMO. An alternative to the NEMO study is the DENIM study, which is running out of Leicester. This compares the anti-cancer effect of dendritic cell immunotherapy alongside best supportive care with supportive care alone. I believe you don't have to be referred as promptly to the DENIM study, but again, please do ask if you're told that your cancer is stable after your first line of treatment. You could ask to be referred to the Leicester team for the DENIM study. Then to move to look at the second line studies. So if you've completed your first course of chemo, you've had a period of being observed, and at the point where you were told that your mesothelioma seems to be growing again, you could ask to be referred for a second line study. So at the present time in the UK, there is Infinite, and this uses a genetically engineered virus that's RAD interferon, and this is instilled into the pleural space, and that's to trigger a naturally occurring process to kill the tumour cells. So all patients in the Infinite study have an anti-inflammatory drug called celecoxib and a chemotherapy drug called gemcitabine, and then half of the patients in the study would also get the RAD interferon, and that is the drug that is instilled into the pleural space. So that's the Infinite study. And then there's the fourth arm of the MIS study, so the stratified therapy in meso study. And the fourth arm of this that will soon be recruiting is looking at the effects of atezolizumab and bevacizumab in PD-L1 positive mesothelioma. And those two drugs are the same that are being used in the first line BEAT meso study. So those are the two studies in the UK at the moment for when you have progressed after your first line of treatment. The two studies that were at the bottom of the original slide, the all-line studies, are Systems 2, and this is a radiotherapy study, and Assess Meso. So Systems 2 is comparing two different doses and regimes of radiotherapy for how effective they are in controlling pain in mesothelioma. So radiotherapy is described in grey, so GY on the slide, and also the little hashtag symbol means fractions. So in this study, you'd be randomised either to receive 36 grey in 6 doses, or 6 visits, or 6 fractions over a period of 2 weeks, and that will be compared to the standard treatment in the UK at the moment, which is 20 gray, given in 5 doses over 1 week. Okay. And the final all-line study is Assess Meso, which is being run by the Bristol team and also other centres in the southwest. It's a non-treatment study, so if you enrol in this study, you can continue on the normal treatment that you're on. And the idea of Assess is collecting lots of information to help us learn more about mesothelioma for the future, and to help us hopefully predict which patients may respond better to chemotherapy or other treatments. So it's very likely that if you're in that area, that your team will approach you to participate in Assess Meso alongside your treatment. So that was just a whistle-stop tour. So how do you get onto a study? That's a question I'm often asked. So arm yourself. So you can network through your local support group, such as Hasag. You can contact ourselves at Mesothelioma UK. We have our information line, and this is our phone number. And we also have trials information on our website. It's a really rich source of information actually to talk to fellow patients or your support group. It's a key trigger point for many patients if they come from centres that only diagnose or see very small numbers of meso patients. So arm yourself with information, get yourself some questions, and then go back to your local clinical team. Ask for your case to be referred to a team who has a mesothelioma MDT. Ask for a team that has a trial portfolio, and ask for second opinion. If you're not sure how to do any of those things, I'll go back to the first point: speak to your support group who would guide you, speak to Meso UK on our info line, or contact us via the website. And that's all from me. So thank you very much for listening. If you do have any questions, please either speak to the Hasag team or contact ourselves at Meso UK on the number and via the website.
Thank you for joining us for this rather unusual virtual Action Mesothelioma event. And thank you to Anne Moylan and Joe Hargrave, Mesothelioma UK nurse specialists. It's a privilege to work with the both of you so closely, and Mesothelioma UK. We're really sad that we're not able to see you all face to face, not only today, but also at our coffee mornings that have been cancelled due to COVID. But we're really enjoying the Zoom coffee mornings that we've been taking and seeing you all face to face there. And we hope to see you all again really, really soon. I want to also thank everybody that's donated, not just today, but over the last 14 years. This has enabled us to fund June Hancock Mesothelioma Research Fund and Mesothelioma UK. And for the last few years, we've been part funding 2 mesothelioma nurse specialists, and we're really proud to be able to say that we can now sponsor 4 mesothelioma UK nurse specialists. So thank you to all of you who have donated, and please do continue to donate if you haven't done so already. We're truly grateful for your support. We're really proud to announce our virtual climb of Mount Kilimanjaro. It's a Team Hasag challenge along with our panel solicitors. All the information about the event over the next 4 weeks will be on our social media, and we look forward to Team Hasag beating everybody else to the top of their mountain. Take care. Bye-bye.